so influenza in the production setting is a common disease. We have identified strains historically that are endemic, and producers are aware of this disease, and they work with their veterinarians on the management options, which involve supportive care and vaccination. But in light of this, prior to 2009 events, there was collaborative work that was ongoing between several stakeholders to develop a pilot program to look at the types of strains that were out there to better understand the epidemiology and ecology. At that time, no public or coordinated plan existed. However, it was really the 2009 influenza pandemic events and recognition of the impact that this had on the industry that really initiated a coordinated response from industry stakeholders in the form of developing an influenza virus surveillance program. And this is just an example of some of the educational materials that went out when this program was put in place to the producers, from the National Pork Board, and as well as to our veterinarians from the American Association of Swine Veterinarians. Again, just reviewing some of the specifics of this program, it is a voluntary or anonymous program unless the producer indicates that they would like it to be traceable, and then the veterinarian can enter their information. The objectives are really to gather the information, create a database of strains out there so that we can better understand the epidemiology, the evolution, and the ecology, to have those isolates available in the database for research activities, and also have them available to develop diagnostic reagents, assays, and vaccines. So Amy's shown a little bit of how that can be used to understand what's happening, what vaccines are not necessarily working anymore, and what needs to go forth. It also has an important public health link, though, because through the database, it allows access through public health to be able to look at those sequences so that they can further their research. It can also sensitize them to the strains that are out there, better understanding those that may have potential for transmission to humans or may have more potential for that. And also it allows us to all be abreast of the situation so that animal health and public health can coordinate when necessary on a coordinated communication. So how does the plan work? Well, we have a couple of surveillance streams. The primary one, which Amy had spoke about, was your clinical samples that come from the farm. The veterinarian submits them to the diagnostic laboratory. We also have samples from first points of contact or commingling. So that would be, for example, your fairs and exhibitions. And then any swine sample linked to a human case. So a lot of this would cross over with samples that may be occurring at fairs and exhibitions. The results that are reported from the National Animal Health Laboratories, and Amy talked a little bit about the 39 laboratories involved in that, are reported to the USDA surveillance unit. From there, an isolate is placed in the repository. And from there, the selected virus isolates are sequenced and entered in GenBank. And that being a public database allows for access to those sequences and to meet some of those objectives that I spoke about earlier. From August 2011 to 2013, we've had more than 8,300 swine samples. Actually, I'm sorry, those are accessions, so that means they can be a collective of swine samples, not the swine samples themselves. Were tested for SIV, and we've seen a marked increase in that through 2012, 2013. And talking a little bit about that with Dr. Korslin, who's with USDA, some of his perception is that that may be from various seasonal fluctuations, but also just an increased awareness, producer participation, veterinary participation in the program. This is some of the recent data that's come out, and as you can see, so this first line is the accessions that are being submitted, and you can see that as of last fall, we've seen an increase in those, sort of a seasonal spike there, but then an increase in our submissions overall. And again, this just sort of breaks it down through the different subtypes we're seeing, H1N2, H1N1, and H3N2. Again, moving on to what we saw last year, and many of you are familiar with this, we saw the emergence of an increase in the number of cases of influenza A H3N2 variant virus. Historically, you know, we'd seen some of these in the past. We know that influenza moves between people and animals, animals and people, and we had seen some movement in influenza viruses from swine to humans in the past. Through August, December 2011, we saw about 12 cases of people infected with this virus. But it was really last summer that we saw an increase in the incidence of these number of cases, occurring mostly with exhibitors, young children that were exhibiting swine or that were in close contact with swine at fairs and exhibitions. Looking back through the surveillance program, the USDA first identified this unique strain of virus in late 2010 in swine, and from October 11 to 2012, this is the current information we have, we're positive 57 cases. I know Tavis has done a lot more work on this and will be speaking tomorrow about this in depth, so I'd encourage you to go to his presentation on some more of the details of what they're finding looking back through these samples. So what did this all mean? Well, when these events first started occurring last summer, this involved or garnered a lot of public health attention. It was possible that this virus was more transmissible from pigs to humans. Because they're always changing, we didn't know if this would move more easily from human to human. And studies conducted, as Amy mentioned, by the CDC showed that children had reduced immunity to this. Now, we have not seen transmission from human to human or sustained transmission from human to human, although we have seen that children seem to be more susceptible to this virus. In terms of a checkoff response, this was a little bit different than 2009 for us. The show pig population is inherently different than our commercial population. The risk factors are different, but many of the control measures can be applied universally. So during these events and continuing forth, we've worked closely with our stakeholder partners on this with information and messaging needs. We have a dedicated website with a number of materials available for swines and exhibitions. Following the 2009 events, we also sat down with CDC to talk a little bit about some of our communications and messaging, understanding that a lot of the public misperception with 2009 was involving the safety of pork and pork products and using the terminology such as swine flu. And we've seen since then some standardization in the naming of the influenza viruses. So for instance, the H3N2 variant virus, that came out in early 2012, a standardized naming through the World Health Organization. And we also have a fact sheet available on our website to help the media and the public better understand this, or the media to communicate this better to the public. Lisa Becton has also worked on a youth swine exhibition biosecurity, which gives sort of an overall biosecurity for those exhibiting swine, but also has some components in there about influenza and you'll find that available at the Pork Checkoff booth. One of the things that also came out of all this was really a talk amongst all the calls of what are we going to do next year, being this year 2013, with respect to guidance for fairs and exhibitions. So we brought together a group of those that had some of the cases last year from Indiana, Ohio, Illinois, and Minnesota, and talked a little bit about what had happened, what we saw, what we thought, some of the lessons learned and we could take back from that for next year. And that was a really, really good discussion and evolved into the formation of the Swine Exhibitions Influenza Working Group, which was co-hosted by Joni Sheftel from National Association of Public Health Veterinarians and Dr. Brett Marsh from the National Association of State Health Veterinarians. And that is an influenza guidance document also up on that website available that gives some guidance to the exhibitors as well as the fair officials on some of the guidance surrounding how to minimize transmission of influenza at fairs and exhibitions. And I think Joni will probably mention that a bit more and can certainly answer more questions about that in her presentation. We've also been working closely with Amy's bioinformatics group, and she showed some of that information there to be able to look at that database, analyze some of those sequences, and better understand some of the epidemiology. And she's had several publications from her group come out of that that I think have been very encouraging to better understanding this. In terms of 2003, although less in number, certainly, we have seen some cases at fairs and exhibitions again this year. To date, we have a total of 18 cases in 4 states that have occurred at fairs and exhibitions. And there's continued work ongoing to understand the epidemiology of this particular virus or other viruses and how that transmission works at the human-animal interface. In summary, there's a continued focus through checkoff, through all our stakeholders, on continuing to improve swine health and monitoring for influenza. We know that surveillance is important to benefit both the animal health and the human health side, Biosecurity is certainly an important piece of that to minimize transmission, whether it's directed at exhibitors or other types of production. And continued engagement of all our stakeholders is key in all aspects of production and health.